any technical issues, please use the help widget shaped like a question mark, again, located in your console. Now let's introduce today's guest, Michelle Kirshner. Michelle is the Vice President of Sales at HR Logic, formerly SyncStream Solutions, which is an ACA reporting and compliance company. Michelle is a dynamic, results-driven compliance strategist with 20-year-plus record of working in the compliance and payroll world. She has worked with thousands of employers providing visionary leadership to help become compliant in an ever-changing time for employers and reporting. Michelle, take it away.
Erica, thanks so much. So I'm excited to dive in with everybody. I always want to post my disclaimer here. Know that we need to follow the laws, rules, and regulations. And I post this so that we can keep everybody in a good place. So let's dive in. As Erica said, I'm Michelle Kirshner, and I am the VP of Sales for HR Logics. Today, we're going to be diving in. We're going to be really talking about all of your ACA needs. I think it's important, depending if you're a 101 or a 510. It just depends on your level and your knowledge. So I'm going to handle all of that today as we review through. We're going to go through some filing observations that I have from 23. We're going to talk about data review. We're going to dive in on some common mistakes. We're going to talk about those penalty notices and how to handle them. And then we're going to talk about industry specifications and the risks and everything that comes into play. And then we'll have some Q&A. Feel free to put your questions in, and Erica will have them ready for me at the end. So I like to share with you our relationship with Advanced Partners has been in play for over 5 years. And we feel very valued in this because knowing that they reach to us to help their clients feel like they are with a trusted ACA expert is what we want to have for you. You can see that we are processing for millions, and we've been at this since the inception of the ACA. Now, as I said, I want to talk about a few trends from 2023. You know, many people in the phone calls that I receive from our staffing clients is, Michelle, I'm having a hard time because I'm coding. Number one, if you are still coding your own forms, you do not want to do that. You need to make sure that you can get beyond all of this and that you are with a company that can take care of things for you. We have all of the expertise and knowledge so that you do not have to worry about this. So know that when you come with a trusted partner, it makes life much easier for you so that those red flags and risks are not in play for you. So let's dive in here. I'm going to go a little remedial and then we'll keep going. You know, we talk about applicable large employers and what is their responsibility. You're going to hear me refer to an applicable large employer as an ALE. You're responsible for keeping up with payroll data, census data, plan information, which is your benefit plans, and enrollment information, which is the offers of coverage. Making sure that you have all of that data will keep you in compliance with the ACA. And now to ensure that compliance and perform these tasks, you have to do this on a monthly basis. You are assigned a client service rep who works one-on-one with you from my team. They're going to monitor all your current employees. We're going to talk about MEC coverage, MV coverage. MEC coverage, minimum essential coverage, and MV, minimum value. We'll dive into all of those details. If you're filling out those forms by hand and spot checking those indicator codes for accuracy and consistency, that is something that we are doing on a monthly basis. We really want to make sure that you are looking at it, knowing what's happening, because we don't want you to get to December and be running around with 2 firecrackers in your hand going, my gosh, what am I going to do now? And then we always want to be going over that 95% of full-time employees should receive an offer of coverage. So making sure that that's in place so that you do not receive a penalty letter. So let's dive in now on the basics of ACA reporting. So you've heard me talk a little bit about the ACA and what it is and how it matters and what that means for an applicable large employer or an ALE. As I state to you, an employer with an average of 50 or more full-time equivalent employees. So this is the key piece when you are reporting and knowing what is an ALE. So who's required to report? Those ALEs, applicable large employers, and any self-funded companies. Now, I get a lot of questions on this. Both ALE and employers providing self-insured health coverage, regardless if they are an ALE, must send reports to both their employees and the IRS. So you have to make sure that you're keeping within those lines and standards. Here's another common question that I get asked all the time. Michelle, how do I calculate my FTE status? How do I know that full-time equivalent? So to calculate the number of your full-time equivalent employees, you can use the following steps. You're combining the total hours worked for the month by all of your non-full-time employees, so variable hour employees. You don't need to include more than 120 hours per employee. And then you're taking and dividing this number of the 120. Now, here's a good example so that you can see it on my screen. But again, when you work with us, we're working with you to make sure that this is tracked, reported, and taken care of so that you don't have to be hand calculating what this looks like. I'll always share, if you're still hand calculating inaccurate count of full-time employees, this is a problem. The calculation must be done correctly or the ALE can face penalties. So I would always say to you, make sure that you are in a solution that this can be tracked, reported, and done accurately and correctly, because you do not want to leave room for human error. So let's dive in on some plan requirements. Let's go through what is the minimum essential coverage. So we're going to talk about MEC and MV. Minimum essential coverage stands for MEC. So as we go through, this is qualifying health coverage that satisfies the ACA's requirement. And then what is the minimum value? Meaning this is the plan that pays for at least 60% of covered benefits. And the coverage must meet the ACA's MEC, minimum essential coverage, affordability, and minimum value requirements for that year in order to make sure that you are in full compliance. Now, I really like to talk about these percentages. This is a great way for you to look at this. Healthcare plan is considered affordable if the lowest cost self-only coverage option available to employees does not exceed the affordability percentage for the year. Now let's dive in. First, let's talk about the affordability percentage. In 2024, it was 8.39. For 2025, it is at 9.02. So there is always a change every year. These are the facts going forward for this coming calendar year that starts January 1, 2025. I always like to bring up to people because they're like, when does this come into play? So when we're doing 2024, remember, we're reporting for a year in the rears. We're really looking at 23 data. Let's also talk about the FPL dollar amount, federal poverty line. So the calendar year plans in 2024 were 101.94. And the calendar plans for 2025 are 113.20. So you can see, again, these are things that as your expert, we know this, we have this information, and we're going to work one-on-one with you so that you know it and have it also. So let's dive in and do some defining. How do employees prove to the IRS that the healthcare plans they are offering to their workforce are affordable under the ACA? This is a really important question for all ALEs. Affordability is based on the cost for employee-only coverage under the least expensive minimum value plan offered to the employee. So remember, if you want to avoid a penalty, which would be the 4980H, which is currently being issued by the IRS via a 226J letter, you have to be in full compliance with this. Now, I like to lay out all of the affordability here so that we can talk about what this looks like. There are many levels of affordability, and we can do all of them for you. W-2 affordability, rate of pay affordability, and the federal poverty line. So each one of these, when you speak with your client service rep, they're going to talk with you and find what works best for your plan, how you're offering, and what that looks like, so that you are being advised by an individual who can offer their expertise in the staffing world and knowing what we're doing for so many, and then listening to what you're doing and how you're doing it, I also have chief legal counsel who's able to consult and help if you're struggling or have any needs. Now, I always like to show a 2024 draft form. Now, as you know, these are last year's forms so that you know what it looks like. When you hear me talking about line 14, 15, 16, this is all of the coding that comes into play. One wrong code can throw a penalty instantly to the IRS, and then they're going to issue that penalty letter to you. So know that making sure that you have yourself in line and taken care of, and you're not taking any chances, is always the best play. Now, let's dive in because I get many questions about, Michelle, what are my biggest challenges as an ALE? So let's talk about what that looks like for our groups. Common mistakes, and then I'm going to dive into each one. A failure to perform an aggregated employer group analysis. This is really important. If you are working with a brother-sister company, parent-child company, you have to make sure that you legally have this set up correctly. I'll dive in the next few screens and we'll go over a little bit of detail on each of these. The measurement method, making sure that your measurement method does not align with the IRS rules. This could be an issue. So let's make sure that we get you in the proper measurement period. Misclassifying employees versus independent contractors, health benefits not considered affordable or MV, inaccurate tracking of eligibility and offering coverage. So let's dive in on these common mistakes. Let's take number one. So types of groups. As you hear me talking, what is a controlled group? There can be many different levels of control groups. You could have a parent and a subsidiary group, a brother-sister group, or even a combined group. Parent-child, there's many different combinations in your business. Again, I will share with you, we have full legal counsel that can help guide and advise you on the best proceedings for your business. And then again, always making sure that that analysis is done by a professional who can make these decisions and know exactly how your business needs to be set up and reporting. So monthly method versus look back method. You know, my staffing agencies reach to me all the time and say, Michelle, what is the best methodology for me? And I'll share with you, not one group is the same. You all have a lot in common, but depending on all of the facets that play in is why we determine what's going to be best for you. So you may come to us in a monthly measurement method is exactly the methodology that's going to work best. And then I have other staffing groups that come in and look back method is their correct methodology. We're going to dive in with you as your partner to review and analyze and make sure that it's not causing you extra work, that you know exactly how your reporting is going to work best for you and for your company. So let's talk about that misclassification of employees. Again, I speak with a lot of people in regards to the misclassification of employees and what constitutes a full-time employee. Many people think that it's 40 hours. In the ACA world, it's a minimum of 30 hours per week. So always make sure that you're keeping that in your mind. Now, what constitutes an independent contractor? I'm going to just share with you and let you know. You have to make sure that you're properly tracking and calculating your employees' work hours to determine where they fall within the ACA and employee status, but making sure that they're in the right bucket. Are they a full-time? What is an independent contractor? How is that broken out? We can dive into all of those details to make sure that you're not misclassifying workers and that you're doing it accurately and correctly, and that we can lead you in an area where maybe it's gray to you. So we can happily dive in with you. So let's talk about health plan requirements. This is common mistake number 4. You've heard me talk over and over since I've started on minimum essential coverage and the affordability and minimum value. We call them MEC and MV. And depending on your insurance carrier, they can guide you and lead you on one of the best proceedings for an affordable plan under the ACA. You need to make sure that you are offering so that you are covered in each one of the penalties that could be issued to you. And then let's talk about the tracking, our common mistake number 5, inaccurate tracking or of the eligibility of offering coverage. You have to make sure that if you are sending out to an employee that they have accepted or declined the insurance coverage, making sure that whatever rules you put into place, that you have something in your handbook that says after 90 days, it's null and void, whatever those proceedings are, making sure that it's fully laid out for you to cover you so that you can accurately report to the IRS who's receiving insurance and who has declined that insurance. So let's now talk about some critical steps for success with ACA reporting. We're noticing a significant rise in ACA enforcement, and commonly you hear me talk about this. They have increased at the IRS, their agents, and what they're bringing forward. So please make sure, because at this time, if you're not covering yourself, the IRS is not giving a lot of excuses for, as I like to say, the dog ate my homework. There's no more of that. So make sure that you're doing what you need to be doing and it's being done accurately and correctly. You want to make sure also that if you're receiving penalty notices, that you're responding to them and getting back to the IRS. As you hear me talking, the IRS can go all the way back to 2015. So you want to make sure that you have everything in line so that there are no issues that the IRS could find. And then you want to make sure that electronic filing plan is in place for this year. We are still taking clients for this year. So if you have not signed up or you're looking to sign up, we can still help you. It's good to start this service in January so that we can accurately track and report, but we can take on clients now until December 1, and that is our cutoff. So I like to at least lay that out there for you. So if you are out there without coverage or not knowing how to get through, know that we can help you with that. And then another area of success that we really need to dive in on is making sure that 14, 15, and 16 on the 1095-C form are accurately coded. This drives all penalties. So you want to make sure that you have good measurement periods in place and good tracking so that when the lines go into the IRS, they're reading 14, 15, 16 and going, yep, accurately done, correct, and they move on. Now, as you hear me saying, there are many things that are going away with the IRS, and I'm going to dive in now on some penalties and talk about that. What you just heard me speaking about is there is no more statute of limitations. So what this means is the IRS can come back from the inception of the ACA, your first filing in 2015, and they can issue a penalty. And right now we know the IRS is about 2 years behind on issuing their penalty letters. So we want to make sure that we have everything in place so that you know you can mitigate your case to the IRS. You hear me talking about the A penalty and the B penalty. So let's take a look at these a little bit. The penalty for the A is employers must offer at least minimum essential coverage to 95% of their full-time equivalent employees. It can result in a penalty if you do not do this. So by providing minimum essential coverage for a MEC plan, you can steer clear from the penalty A. If you choose to not, you can see my parameters here of what that could lay out for you and what a penalty could look like. Now, the other penalty that we talk about is the B penalty. This is employers that must offer a minimum value plan that meets 60% of the value. That's including the hospitalization services, and the employee is eligible for a premium subsidy if they apply for coverage individually. So I can dive in with you on those A and B penalties. If you have questions, I'm happy to talk with you, and we can set up a meeting and go through those. I like to give examples so that you can see what this looks like. So a penalty A example, if a business with 150 employees has one full-time employee who goes and gets a tax subsidy from the marketplace exchange, minus the first 30 employees, because the IRS does give you that, the penalty amount that would be issued is $356,400. You can see these are not minimal numbers. Penalty B example is if a business with 230 employees has 20 full-time employees who received the PTCs through the marketplace for 2024, totaling 240 months, the penalty there could be around $89,200. You want to make sure that you have everything in play so that you're not setting yourself up for failure. This has now been over 10 years of reporting for the ACA. So as you hear me saying, the IRS is really not taking many excuses anymore. I like to talk about areas of risk for ACA noncompliance. And staffing is one of them. Staffing is one of the leaders. So industries with a large number of hourly workers, seasonal employees, and variable schedules, those are all examples of risk for ACA. When we have that high staff turnover, we know that this also causes a problem with health plans. So making sure that everything is in play is very important. Variable hour employees working in multiple locations or multiple departments or multiple pay rates, again, a large risk for ACA. Industries at high risk are home health care, staffing, hospitality, manufacturing, and construction. So know that we can guide you and lead you through all of these areas so that you can feel confident and comfortable and know that it's being done correctly. Now, earlier you heard me say about my chief legal counsel and myself. We work very closely together. And last year alone, we mitigated over $650 million in penalties. I'll share with you some case studies here. A staffing client with multiple U.S. states of operation, 962 employees, coded 1H and affordability. That is the issue. When you hear me talking about lines 14, 15, 16, the wrong code in that line could really throw a terrible wrench in your plan. As you can see, the penalty that was issued to this group was over $2.5 million. We mitigated $2,549,000. You can see we got it down as close as we could. There's some things that you just can't avoid where the IRS will say, why did you do this? Again, they're going to try to do their best to mitigate as much as they possibly can, but it is the employer's responsibility. So let's take a look here at minimizing compliance risks and the administrative burden from your yearly ACA filings. Making sure that you have the accurate determination of your full-time and part-time employees' status is crucial. To avoid the penalties, ensure the ACA compliance demands, carefully manage your ACA regulations. We say to you, working on your ACA 30 minutes a month will help lead you and guide you so that you will not be running around with two firecrackers in your hands in December. So making sure that you're working on this on a monthly basis and not an annual basis is always very important. And then making sure that ALEs must provide that minimum essential coverage to at least 95% of the staff. Now, let's go and talk about the ins and outs of the ACAs, because this is important for you to know. What are the expertise and the things that I need to have in my belt, knowing that I'm taking care of things accurately and correctly? Legal expertise and certified ACA compliance expert is something that you need to look for. Knowing that I have my chief legal counsel that can help guide, lead, and help you through processes are very important, because as business owners, you never know what you're up against or what may happen. My staff is tenured and has been here since the inception of the ACA. Again, you're going to hear me talking about that monthly compliance risk reports. We're going to be working with you on this so that your client service rep and yourself are looking at your account, knowing what those risks are, making sure that we're monitoring and watching the full and part-time employees. If anything's coded incorrectly, we're catching it on that monthly basis. And then many clients come to us because they have state filings. We understand that there's a federal filing and a state filing. Right now, there are 6 states that mandate a state filing. If you're in one of those states, we identify that with you and make sure that you do both filings, the federal filing and the state filing. Again, making sure that we are keeping our solution up to date with all the laws, rules, and regulations, and making sure that my legal counsel is reviewing that annually helps us to make sure that we can keep you in good hands and that everything will be taken care of for you, no matter what your complex scenario brings to the table. So I am going to open it up for some questions. Erica, did any questions come in?
Some did, yes. We have about 2. Thank you, Michelle. That was wonderful. All right, so the first one, Can you take care of past year's filings from 2020 for ACA?
Yes, as I stated, we have been doing this since the inception of the ACA. If you have a filing that needs to be done for 2020, we can help you, guide you, and lead you through that and get you current so that you can get that target off your back with the IRS.
I haven't filed for 2023 yet. Am I still able to?
Yes. We just had a client come through the other day that didn't realize they needed to file. They recognized that possibly they could have been an ALE. We put them into our solution and determined instantly that they were an ALE and that they need to file. So we're getting them current for 23 and then also taking on their 24.
Wonderful. Those are the only questions that came in. So this concludes today's webinar. Thank you everybody on the line for your attendance and your attention. Again, these slides will be emailed to you. And we will also, oh, one just came in. I'm so sorry.
Oh.
I was talking. What are the 5 states that require state filing?
Do you know what? I will be happy to send that, and I will send that with a recorded webinar so that you can have that and list that out for you so that you know that. Erica, I'll send that over to you. How does that sound?
The 5 states? Okay. Yep, that works. All right. So the person who just asked that question, expect a response to your question via email this afternoon, and we'll get you the answer to that. Thanks, everybody. Take care.
Bye-bye.